One of the key action areas of the Ottawa Charter was reorienting health services, and it was incredibly important for us to have that as part of the Ottawa Charter. That was in the tradition of the Alma Ata Declaration, of course, the concept of primary health care and intersectoral action, and that the health sector itself has a very, very important role to promote health, not only to treat disease. And therefore, making that point that the health sector is absolutely critical in shaping our views on health in society, that it should advocate for health in society, and that it needs to be part of a larger ecosystem of health and well-being is incredibly important, and even more important today, I would say, than it was 35 years ago in the Ottawa Charter. The relationship to the Sustainable Development Goals is, of course, critical. If you look at SDG 3, again, it is about health and well-being. But within SDG 3, there are not only the disease categories that we had under the Millennium Development Goals and the special groups like women and children that we have to keep in mind, but explicitly a call to establish systems of universal health coverage. And that systems approach, again, of the SDGs for health, to say we have to build institutions that are part of a social contract, that involve everyone, meaning they are universal, and that in turn help support health and well-being, is a really great breakthrough at the global level, and is of very great importance to networks such as health promoting hospitals and healthcare systems. If people want to start a health promoting hospitals or health systems initiative, it's very important to learn from the 30 years experience of what we have called the settings projects. It's not about just including a new patient education program within the system. It's really about making the whole system, the whole hospital in this case, committed to health and well-being. That includes the staff, that includes the community, of course that includes the patients, but also it includes many of the other environmental issues that are at stake. It includes the hospital waste. It includes what is sold on hospital premises, alcohol and soft drinks, for example. So we're really talking about a health promoting system. And since a hospital is usually part of a living community as well, if the hospital gives such signals for health, it will be a signal for health into the community. So definitely when one starts, one should start in an integrated way. One should involve a whole range of stakeholders. It cannot just be a program from above, but it needs the commitment from the leaders of the hospital to move forward. But the experiences has definitely been the more democratic and the more inclusive the health promoting hospital approaches have been, the more successful they have been.